Having seen all the risk factors, let us now look at what is meant by genetic breast cancer, or what is the influence of genetics in breast cancer. It is the genetic breast cancer is described nowadays as a pre-Angelina Jolie and the post-Angelina Jolie era. Angelina Jolie came out in the open to announce to the world that she had had a bilateral mastectomy with immediate reconstruction to prevent breast cancer. And after that, genetic breast cancer, or the whole story of genes and breast cancer, became very, very popular. So what is genetic breast cancer? If a family has a abnormal gene, which is the BRCA gene, it is either BRCA or BRCA1 or 2, and there are some 3 or 4 other very important genes, then the family is labeled as a family having a genetic predisposition to developing breast cancer, and the risks may be as high as 60 to 90% lifetime risk of developing breast cancer. Also, in the BRCA1 genetic mutated breast cancer families, the breast cancer that happens or that occurs can be extremely aggressive, of the triple negative or the basal like type. So how do we deal with these families or patients who have these genetic mutations? One, these families can be put under very aggressive surveillance. That means they are made to do ultrasounds and physical examinations every 6 months and a mammography every year, coupled with doing an MRI. The other advice to such families is to completely change their lifestyle and try to do all the things that we described in the lifestyle segment to prevent the risk of developing breast cancer. And finally, some drugs can be given to these family members to reduce the risk of breast cancer. And then what Angelina Jolie did is looking at some preventive surgeries when you have a lifetime risk of around 90% to reduce the risk of developing breast cancer, which is of a very aggressive nature. And therefore, it is advocated and prescribed to a very select few patients or families who have this genetic mutation to undergo some preventive surgeries, such as removing the ovaries and the tubes, and or doing a bilateral prophylactic mastectomy with immediate reconstruction. The techniques of reconstruction have become so refined that patients actually have better cosmetic looking breasts after this surgery, and hence the surgical trauma is not at all high in such patients.